Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Jordie Cohen. She's a nephrologist. Her Kevin MD article is titled, How the U.S. Blood Pressure Validated Device Listing Ensures Accurate Readings and Revolutionizes Hypertension Control. Jordie, welcome to the show.
Thank you so much for having me.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Yeah, so I'm a nephrologist and hypertension specialist right now at the University of Pennsylvania. I grew up in a medical household. My father was a primary care doctor. He was a family practice doc. He was solo practice, and my mother was his only employee. And they did not have a single computer in their office for almost the entire duration of their practice. This included when computers became required for many forms to be submitted and things like that. And so I was in elementary school doing a lot of things like that. I grew up in their medical office, and my dad had mercury blood pressure cuffs on the walls in the exam room for decades. And he taught me how to check a blood pressure when I was 5 years old and used to lightly smack me on the head if I got a step wrong with a cuff. And so I had it in my blood. I think that I was going to end up obsessed with blood pressure. So I did my training at Rutgers, went to Boston University for residency, went to Penn for nephrology fellowship, and lo and behold, didn't realize that it would happen, but fell in love with blood pressure during nephrology fellowship. And so now I lead several trials and other long-term studies related to better managing hypertension, including studies in patients that are frail, multimorbid, very medically complex patients, and trying to determine if we're really doing things right or if we can do better.
Wonderful. I also went to Boston University for internal medicine residency, so always wonderful to meet a fellow BU alum. When it comes to blood pressure, you're on the forefront. Tell us what can we expect next in the foreseeable future in the primary care setting.
I think we're going to be seeing a lot of patients using cuffless blood pressure devices and either telling us or not telling us that both could be quite challenging and difficult things to manage, because we'll be getting contact from patients asking what it means when their blood pressures are buzzing that they're elevated when they're crossing a street and almost get hit by a bus, or doing some other activity that wasn't intended to be having a blood pressure measured. And I think also maybe not telling us they're doing it and perhaps making their own decisions and doing other things based off of the readings that they're obtaining on these devices. So I think it's got the potential to expand access to blood pressure measurement for many patients, but I'm also quite reticent about some of the potential dangers of these because they really aren't well vetted yet.
Now, for those non-clinicians listening to this podcast, just in a nutshell from your experience, why should we care about blood pressure?
Oh, great question. So blood pressure is a precursor or puts us at enormous risk for developing stroke, heart attack, worsening kidney function among people who've got kidney disease, heart failure, other major cardiac issues, and can worsen people's quality of life because of that. And so it's very important that we learn what our numbers are, that we get identified as having hypertension or elevated blood pressure early and get treated to avoid having these negative outcomes.
And patients ask me all the time in the exam room when they have their own blood pressure devices, what are some ideal numbers that they should be looking for?
If you ask the American College of Cardiology and the American Heart Association, the ideal number is less than 130/80. But there are some caveats to that. If you're really low risk and pretty healthy, you really don't need to start medication per se until your numbers are over 140/90. If you're really high risk, for instance, patients I see with chronic kidney disease who are at an elevated risk of heart disease compared to other folks, then their goal should actually be less than 120/80, depending on who you ask and which experts you believe.
Wonderful. Let's talk more about your Kevin MD article. It's titled How the U.S. Blood Pressure Validated Device Listing, the VDL, ensures accurate readings and revolutionizes hypertension control. Now, how did your article come together?
Yeah, so a few years back when I was sort of an advanced nephrology fellow, I started to realize how many blood pressure devices are available both in doctors' offices and to the general public. that are completely unvetted and that we don't know whether or not they're actually recording an accurate blood pressure or if they're wildly off, like 15, 20 millimeters of
Yeah.
mercury off in many people. And so I got involved with several folks that were interested in this, as well as with the American Medical Association. And we all worked together to develop this validated device listing, which is a carefully vetted device listing of blood pressure monitors that are actually appropriately assessed for accuracy.
So what goes through that certification process?
So we require that the companies have an external group that doesn't have any conflict with these companies performing blood pressure accuracy or blood pressure validation studies according to international standards. There are some older international standards that were not very rigorous, and we don't allow those. We really require the most rigorous of international standards. The most recent ones were from 2018, and that's what we're sort of really encouraging everyone to do. These standards in general require that a blood pressure device be within about 5 millimeters of mercury of a gold standard device that is either a mercury blood pressure device or one that's been recently calibrated and recalibrated with a mercury device. And so the 5 millimeters of mercury has some wiggle room, but that's sort of the average or very simplification of what we're looking for. But there are a lot of steps that they have to follow. The studies have to have a certain number of individuals across a range of arm circumferences and a range of ages to make sure that it adequately represents the general public, because these devices only estimate blood pressure based off of an algorithm, and that algorithm can be affected by things like arm circumference, by blood vessel behaviors that can be impacted by things like age. And so we really require that we make sure that they will work across a reasonable range of people.
So often I ask my patients to check their blood pressure at home. So now they're home, they're going on Amazon or some type of CVS or Walgreens looking for a blood pressure device. What should they be looking for?
Well, they should be going to the website, I think, before they go and purchase one. www.validatebp.org is the website. And this is what I mentioned. It was originally sponsored by the AMA, but now the folks who are coming up with the recommendations for the blood pressure devices are an independent review committee. So AMA doesn't get any money for it or doesn't sponsor us in any way. And we are all physicians that are hypertension specialists checking that these are valid. That is really the best way to know if a device is actually accurate. Do not look for just an FDA check mark, because FDA clearance, shockingly, doesn't really mean very much in terms of accuracy. The FDA doesn't have any jurisdiction over whether blood pressure devices are being sold or that are claiming that they're checking a blood pressure, whether or not they're actually accurate or actually checking a real blood pressure. And when they actually clear a device, it's not FDA approval. It's something just called clearance. It's a 510K process, which is about what they do when they're checking whether a Band-Aid is safe to use. They do ask companies to claim if a device is accurate or not and to say, oh, yes, we promise we validated it. But no one's going through these validations and checking to see if they mean anything or if it's actually for the device that they claim.
What are some of the most common reasons why a device wouldn't be validated or just wouldn't be accurate? What are some common reasons why that happens?
Yeah, so the reason it wouldn't be validated is because it's expensive and hard to run these validation studies. It's really hard to find like the range of individuals that actually have a broad range of blood pressures, range of sizes, range of ages, things like that. So I understand that it's the easier road to not perform it. But in terms of, I think many companies really just check their devices on the engineers and the folks locally who are available to them when they're developing these devices, or they use old arcane algorithms from prior devices and they sort of redress the device, change everything about it, maybe make a more comfortable cuff, make it look flashier, add some Bluetooth. And there are certain changes you can make that really wouldn't be meaningful, but once you make enough changes, it's a whole different device and it's no longer checking things in the same way. Particularly the cuff really matters that you use on your arm, because that's really what's sensing most of these oscillometric waves that travel through your blood vessels that estimate the actual blood pressure. And so if that cuff is changed in some way and then they don't revalidate the device, it can be really, really grossly inaccurate, and the company doesn't even realize it because what they're thinking about more is how can I market this to more people.
Now, in general, what proportion of commercial blood pressure devices aimed towards a consumer are in fact validated?
Less than 20%.
Are these devices generally more expensive than ones who aren't validated?
Yeah, so Dean Picone and several researchers have looked at this really carefully, and they found that they were slightly more expensive. The blood pressure devices that are validated, maybe about $10 more expensive, about on average, but it's not a huge difference. You can still get many outstanding validated devices for less than $40.
Now, for those devices that aren't validated, is there any value to them at all? Are those readings better than nothing, or is it simply just not getting any readings better?
Yeah, so one thing we've learned with the validated device listing that's been fascinating to me is that many companies don't publish their validation studies, but actually do things right and actually go through the entire process and do independent validation. But it's hard to publish the studies because a lot of journals don't think it's particularly interesting to publish yet another validation study of a blood pressure device. So what we've learned is that some of these devices might not be checked off as actually being validated in these general searches, but if we carefully vet them, there are some that truly have been. And so we serve as peer reviewers essentially at the validated device listing for devices that haven't been published in terms of their validation study, but they actually work. And so what do you do as a consumer or as a provider in terms of handling this? And I think the best thing you can do is ask your patients to bring in their cuffs. Ask them what type of cuff they're using. It really should be an upper arm cuff across the board, unless somebody's had a bilateral mastectomy, and they have lymphadenectomy, so they end up having pain if you use an upper arm cuff, or if they're very obese and the cuffs really just won't fit them. Those individuals can use wrist devices, but everyone else should use upper arm because the wrist devices are pretty unreliable for the most part. More upper arm devices are much more likely to be reliable. And so I tell every patient, bring it into the office. It takes 2 minutes for a nurse or a medical assistant to double check it against a better quality office device, assuming that you have one that's validated in the office. And if you're getting it within a few millimeters of mercury, I usually say about 4 to 6 millimeters of mercury of that device, then you know that you're getting something that, at least for that patient, seems to be valid. And most likely has been validated, but they just haven't published their validation.
You mentioned earlier about one of the trends being cuffless blood pressure devices. So talk more about those.
Yeah, cuffless blood pressure devices, most of them use technology that involves photoplethysmography. So this is a similar technology to what's used in pulse ox.
Yeah.
And they have a few different tricks that they're using, mostly with either artificial intelligence or really fancy machine learning tools, to, instead of using a pressure, to try to estimate what your blood pressure is based off of the way that these different pulsations traveling through your blood vessels. And so it's an entirely different idea than blood pressure almost. And so it worries me quite a bit. Most of the devices require that you use a validated blood pressure cuff to check a blood pressure, then calibrate them, but then the calibration can drift very quickly in some of them. And they're all claiming that they're these like amazing blood pressure devices, and they're marketing themselves as being the most accurate device you'll ever see, and none of them have been adequately vetted yet. Literally, the guideline, the international standard on how to vet them, just came out. So they could not have possibly been appropriately vetted yet. I worry most about it because of that pulse ox technology, given recent publications in JAMA New England Journal showing that pulse ox is quite racist, and that there can be a much higher risk of hypoxemia on arterial oxygen levels in people who have darker skin tones that still show a normal pulse ox. And this is the same technology now. These companies are not adequately publishing if they're even looking across ranges of skin tone, and if they're adjusting or accounting for skin tone in any way and developing their algorithms. So I'm just very concerned about the possibility of them introducing some systemic racism. Hopefully that won't be the case, but I think we should all be really cautious and should be holding these device companies to pretty high standards when they're putting these new devices out that, again, haven't been vetted, yet they're advertising them as the most amazing device ever.
So they are widely available now, and in general, what do these cost as
Yeah.
versus say a validated traditional blood pressure cuff?
Several are available now. Several are FDA cleared, even though, again, there's no formal assessment for accuracy in these devices available yet, or just came out in the last few weeks. And so in terms of the price, I believe they're all quite a lot more expensive than what a typical blood pressure cuff would be. Then there are several other that are being marketed that are not FDA cleared and that aren't even checking a blood pressure, that are really just random number generators. And those have been around for quite a while. If you look on Amazon or other online retailers, there are quite a few of these that claim that they're checking a blood pressure, and they really most definitely are not.
So other than going to the VDL list and making sure that their cuff is validated, What other red flags should patients watch out for when considering a blood pressure cuff?
I mentioned wrist devices I tend to avoid unless you
Yeah.
have a real reason to need one. Other red flags you should look out for when purchasing one is if you're not purchasing it from a non-typical retailer. I'd say go to your pharmacy. Most pharmacies have several validated devices available off the shelf. If you're going to purchase it online, you really need to do your research. And that I think that if you're purchasing it from a pharmacy, it's not a guarantee that it's a great one, but it's still at least more likely to be one that's been vetted.
We're talking to Jordana Cohen. She's an internal medicine physician, nephrologist. Her Kevin MD article is titled How the U.S. Blood Pressure Validated Device Listing Ensures Accurate Readings and Revolutionizes Hypertension Control. Jordy, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Take-home messages are that blood pressure accuracy really matters. We have these narrower and narrower blood pressure goals as time is going on. And if we're not checking an accurate blood pressure, we could be causing patients to have quite a bit of negative effects from their medications that they don't need to be having. We can both over and under treat. And so really important for us to be thinking about how accurate the blood pressure devices are that we're using, to be making sure folks are checking blood pressures correctly with accurate devices. And we have tools available for us to do it. Upper arm devices that have been validated, listed on our website, www.validatebp.org, can really provide us with more reliable information.
Jordy, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thanks for having me.